Thank you, Neil. Good afternoon, everyone. It's absolutely great to be with you all. And it feels like a long time coming. It was a long time coming anyway, and then obviously with the delay that we had 2 months ago. So my name is Tim Welch. My pronouns are he and his, and I am the Chief Executive of Cheshire and Merseyside Partnership, who along with Mercy Care and Alder Hey are the main NHS providers of mental health services across Cheshire and Merseyside. Although I'm very, very conscious that actually a lot of the partners that we work with are here today who aren't NHS providers. I'm also, as Neil has said, I'm the SRO for mental health across Cheshire and Merseyside. In both my roles, I'm acutely aware of the importance of ensuring the right mental health and wellbeing support for people in crisis is provided at the right time, and we have to work with partners to resolve crisis, to resolve the causes, rather, of poor mental health. We have been making significant progress across the last couple of years, almost despite the pandemic. Across that time period, we've seen the implementation of the new first response model, and almost overnight, it felt like, it was certainly within a couple of weeks, we were able to get a 24/7 crisis line for all ages set up and running. We've also, across that time period, made sure that we've got coverage across the whole of our geography, crisis cafes, and you're going to hear from Joe later on. It's absolutely fantastic. Joe and I have never met in the flesh, but I know all about Joe and Joe's work, so it's great to see him, and I won't steal any of his thunder. And then we've got sort of smaller items, sound. We should have done these things years ago, but actually in terms of alternatives, so things like the Shout text service, which actually has seen a phenomenal increase in usage, particularly from the younger population. But there is more that we can and should continue to develop. A lot of progress is being made now in terms of mental health support teams within schools. This is the first academic year where that's really got going, and we need to build on that and strengthen that. Secondly, and I think this is where many of you who work in the third sector will start to have become involved, is the revamping and transformation of community mental health services, and particularly working with you all in terms of making sure that we're able to get the right service at the right time for people in crisis. The last 2 years, 2.5 years actually, probably now, have been hard for everyone. And whilst there are more challenges ahead, particularly with the cost of living, reading the strategy and the emphasis on a strong lived experience voice, I am optimistic we can work together to develop a better outcome for our population. Ruth and colleagues, thank you so much for inviting me today. It's going to be a fantastic opportunity to listen to all the great speakers that we've got, but also to network. So I think that's enough from me, and get on to actually the really important people for speaking for the day.